It was really an amazing data analysis that we were able to take a look at and analyze. And I think we expected to have some good findings, but I don't think we expected it to be this amazing. And also the relevance to clinical practice, the things that we're going to be able to tell our patients with confidence after having this data analysis. And that is extremely important to someone who for the first time is having success in their treatment, especially in migraine, which is such a disabling disease for someone who might not have any other medical problems, especially in someone who in the deliver population has tried other treatments and has felt the sense of failure. Oftentimes these patients come to us feeling like, are you sure this is migraine? Because everything is failing me. Are you sure there's not something else wrong with me? And for the first time might take a very specific treatment for migraine and have this, oh my gosh, like, is this the way I was supposed to feel the whole time? And really come out of it feeling amazing. And if they have that bump, that fear comes back. So to have results like this that really say, the data shows us that there's a very, very 90-something% chance that if we continue on, you're going to go back to having that greater than 50% response if that's who you were after the first 2 rounds. I do think it's very difficult for people with migraine to kind of go through the system. There's a lot of great data that's been presented at the AAN this year that goes through the patient journey and how many times they might have gone through the healthcare system and felt that sense of disappointment. I think as a clinician, it's very hard for us because the anger sometimes comes out on us, and I think it's very difficult for us to continue being positive and, try to take that anger on and say it's going to be okay. I think understanding where the person is coming from is first and foremost. Even in our busy day, even when we're 30 patients in and you're like, I don't have the time for this, take that moment, take that deep breath and realize a lot of the anger comes from their frustration with the disease process, and reflect that back to them. I hear you're upset. I know this is a difficult journey because this disease is so terrible. I know you've taken a lot of treatments. I can see that. I can see where you're coming from. There's still some new treatments out there, and if those are failing you as well, there are new treatments that are in clinical trials right now. And I think it's important to reflect that back to them, that even if they haven't found the right treatment at this moment, there's still treatments in trials that are different from what are currently out there, and that things are still out there for them. Hope is still existent. We haven't found all the right targets. It's not like CGRP is going to be the end game for everybody. We know that, and to just hang in there. And that's hard, but I think what's important for people to hear is there is still more and people aren't giving up. And you as the clinician, sometimes just having that person that is saying, there's more, maybe I'm not the right person, but let's find you someone else that can help you. Let me be that link for you. Let me try to find a trial for you. Let me, be the one that hears your anger and try to help you understand that I understand that your anger is really about your disease, which is a terrible disease. And it is definitely hard on us. I 100% am always there getting yelled at and can feel that sense of, wow, this is really tough. But I always remind myself, the anger, the distrust, the everything going on is because of everything out there and what they're going through. And just when you take that moment to deflect some of that and ease the situation, what comes out on the other end is trust and the realization that, wow, they're so frustrated, because I would also hate that if there was no treatment that was working for me. And I was in a situation where I was scared and I didn't feel like anyone could help me. And if you just take that moment to have that, well, maybe there's something I can do and find the right place for them, and take that moment to reflect that, it really does change the dynamic. And even just doing that, finding a person for them to see, is a huge step in the right direction. And when we see the patient as the next step, I will tell you how often they're grateful for their general neurologist, their primary care physician, and we hear that positively. I always wish that they call them, did you tell your doctor that you love them? That's really important as well. So I think just trying to keep that hope going and realizing there are trials in development, there are trials ongoing for treatments that are not yet out there, that are focused on different targets for those that have not yet found the treatment that's working for them.